Now we're going to do maintenance and massage for the shoulder joint, which will include latissimus dorsi, deltoid, all the rotator cuff muscles, teres major and pectoralis major. We're going to start by drawing on latissimus dorsi, the wide back muscle. Your landmarks here are the two PSIS areas, the SI joint area. So you find that little lump, which is the top of the SI joint, and then make a mark. At the top of the center of latissimus dorsi is T6 spinous process. So you can do a couple of ways: find C7 and count down, or find T12 and count up. Either way, I'm going to do C7 down. So there's C7, 1, 2, 3, 4, 5, 6. Next spinous process right there. I'm also going to make a little mark dead center right about the drape. And the other landmark is actually going to be the top of the axillary crease here. We're not going to make a dot. We just are going to use that as a visual landmark. So you're going to come from the top of that axillary crease to your T6 mark. And you're going to go from top of the SI joint also to that axillary crease. And then from your T6 down to the center at the bottom. That's your outline. We draw in muscle fibers, again, by making a dot every inch or two down the center. And then all of your lines need to start at that axillary crease and come to those dots. Like that. So there we have latissimus dorsi. If we've done this correctly, it should lap over the inferior angle slightly, because in most people, that is one of the important points for this muscle. It goes right over the inferior angle. All right, our next muscle will be deltoid. Deltoid origin, is the same as trapezius insertion. We're going to do spinous scapula, round the acromion, and then out about an inch onto the clavicle. I just draw right on top of the spine, round the acromion ledge, underneath, slightly onto the clavicle. That's origin. Insertion, a little more difficult to find. Your client's going to have to help you. They need to put their palm into the side of their leg and gently press in to keep the humerus at the right angle. The easiest way to find this, it's going to be about halfway down lateral surface of the humerus. Palpate the deltoid muscle and just keep palpating down until you feel it drop into a little valley, and that is going to be insertion of deltoid. Also, typically it's a little sensitive, so they may help you. To draw on the muscle fibers, we simply go from the insertion. Go ahead and draw dots here. There's posterior and part of the middle deltoid. Rotator cuff muscles we are going to draw are infraspinatus, supraspinatus, and teres minor. We will not draw on subscap. First of all, let me repeat what I've done here. 67. 1, 2, 67. 1, 2, 3, 4, 5. It's actually right about, I'm going to go from T12, sorry. 12, 11, 10, 8, 7, 6. Right there. And top of the SI joint, each side, center, back to center, axillary crease, should take it across the inferior angle. Then from the axillary crease to the SI joint, make your dots. Come from the axillary crease to the dots. Deltoid, all along the spine of the scapula, around the acromion, and about an inch onto the clavicle. And then arm flat against their side, palpate, deltoid, down about halfway. It's probably going to be right about there. Make a few dots on your origin. There you have a deltoid. Rotator cuff. We're going to do infraspinatus first. There you go. Palpate inferior angle and then just come straight up onto the posterior surface of the clavicle, 1/2 inch to 1 inch. Make a dot, different color, blue, let's say. And then right about here, that medial corner of the deltoid, just follow its medial edge down about 1/2 inch, make another dot right there. The third dot is the most difficult. Find the greater tubercle here of the humerus, come around to the back side, right about there, make a final dot, connect into a triangle. Muscle fibers go from that outward corner back to the medial line, and there is infraspinatus. Supraspinatus, we keep it pretty simple. We find the spine of the scapula. We get just above it and draw a line parallel to the spine, but just above it. That will be supraspinatus. Going to do teres major first and then teres minor. Teres major, again, locate inferior angle. And then draw an oval a couple of inches long right up the lateral border of the scapula. So palpate the lateral border, and from that would be origin attachment. And then go up another couple of inches and draw another oval that overlaps it a little bit, and that will be teres minor. Both of those are right on the lateral border of the scapula. Okay. Inferior angle, come up a little bit, that corner, and down a little bit. Palpate greater tubercle, come to the back side just a little bit. Make your triangle. There's your infraspinatus. Palpate the spine again, get just above it. Draw a line for supraspinatus. Back to your inferior angle. You're going to go up the lateral border here a couple of inches. You're going to draw an oval from the inferior angle up the lateral border like that. And then you're going to go further up, maybe a couple of inches up the lateral border, and draw another oval that overlaps like that. Teres major, teres minor. Again, if students want to take some snapshots with their cameras, that's fine. Now we need to get rid of it, add more oil, and wipe it off. If there are little marks left, that's fine, because once you start your body work, they'll come off. Stroke sequence, effleurage, petrissage to warm up, compressive effleurage to get the work done, and finish with effleurage. Start with a lat. Lat is big enough that you could actually do this work with the heel of your hand open-handed or with back knuckle, but it's the same approach. It is deep, it is slow. You do little pulses about once a second. Remember, if I'm working across the body, I need to go this way. If I'm working on the same side of the body, I need to stand up here and go this way. Go with the fibers. Back knuckle. Final tight spot, you might go ahead and go back to supported finger so you can isolate on that tight spot. I'm working across the body. Going to work out and up because that's fiber direction. The more superior I get, the more horizontal it gets. Nice little addition is to get down on the surface of the scapula and just do some very brusque friction until you feel heat. That'll help loosen up the thoracolumbar fascia back there that may be holding down the latissimus a little bit. And I'm going to switch sides here, excuse me. We've already warmed up this deltoid. One of the problems we're working is the deltoid. We're going to do deep work. We want to be going up, which is traditionally the safest way to work deep in a limb is to go distal to proximal. But if you're going to do a thumb wedge, which is what we're going to do here, without somehow anchoring the arm, you get this effect. Shoulder girdle rides up. We're going to do two choices here. Traction their arm down, get their palm up, open, and if you've got good balance and you trust yourself, put your knee there, anchor it down. Then, always from insertion to origin, thumb wedge, pressing down until thumb tips turn white. And admittedly, this is awkward. And if you're short in comparison to your client, it's probably not going to work. Another way to do it is to make them work for you. Give them the same position and roll up, their arm under their thigh, and they will hold it for you. Now you can come up, concentrate on your work. Notice my very narrow angle, which is what you want. Don't let your thumbs get out like this. Don't open that angle. It's a good way to damage your thumbs. Keep the thumbs straight. That. Infraspinatus. Might give it a little extra warm up with some kind of sliding friction. Move the skin around on the underlying tissue. Remember, you have skin, connective tissue, thin layer of muscle, and then bone. So don't hammer down in here. Fibers run this way. This is a very narrow, small area, so probably you just want to go either with a couple of fingers triangular or thumb wedge. So I'm working origin to insertion. You also need to work insertion to origin, which simply means you go this way. When folks are learning this, they tend to cover too much of an area. You've got maybe 2.5 inches on the side of your triangle. This is a very small area. So if you feel yourself get out here and drop off, you've gone too far. Stay on the back side of the scapula. Scapula is notorious for causing trigger points. But while you're here, get a nice firm finger pad connection and go cross fiber. And what you'll feel, if there are little fascicular spasms there, it feels like a toothpick buried in the muscle. And check in with your client. What's going on right there?
It's a little sore.
Feeling anything referred?
No.
Okay, so it's tender right here, no referral, you still need to work it. So, hold. 8 to 10 seconds. Kind of circular friction out. Come back to it if you want to. Very classic pattern for infraspinatus is tennis elbow, golfer's elbow, carpal tunnel. Mimics all of those. All right, supraspinatus, you got to work with one thumb. Sometimes you can work by supporting your own finger. Thumb, for me, is easier. What you want to do is put this, you want the shoulder up by the ear for this one. Supraspinatus is totally covered by upper trap. The way you soften an overlying muscle is you get it into the shortest position possible, which is this for the upper trap. Now, this is nice and soft. It's not stretched out and tight. I find the spine of the scapula. I get my thumb. I get right down in that groove, that supraspinous fossa right behind it. I'm always holding her arm and pushing up into the head area to keep that upper trap shortened. You can also work across, bring it up. This is be easier to work with a finger or two. Teres major minor. You've got to put the inferior angle right in the web of your thumb, right here. The index finger on the medial side, thumb on the lateral side. it's like you're gonna pinch the scapula like that. When you do that and you press into the side of the scapula, your thumb is right on teres major. And so you just keep your thumb there, do a little up, down, cross fiber friction. The teres major is an internal rotator, so if you need to check to make sure you're on it, bring their arm off the table and tell them to press toward their hand as far as, no, toward your palm, sorry. Go this way with your arm.
Okay.
And if they do that, you'll feel that tighten up and you'll know you're on teres major. So you work that, nice well, and you just slide straight up the lateral border of the scapula, about 2 inches, and there is teres minor. Teres minor rotates the other way, external rotator, so if she goes toward the back of her hand, that tightened up right away. I know I'm there, okay, relax. Okay. We are going to have her turn over supine so we can work pec major and the remaining rotator cuff muscle.